Hunter syndrome is caused by a missing or malfunctioning enzyme, and because the body doesn't have enough of this enzyme, it doesn't break down certain complex sugar molecules in the body, and these molecules build up in harmful amounts, causing permanent progressive damage to your mental development, your organ function, and your physical abilities. We were in shock. Nothing can prepare you to hear that your child has an illness that you cannot fix. We found out on August 16th of this past summer, 2016, and we had a lot of questions. We didn't understand how this occurred. We had known about the probable diagnosis for a couple of weeks, and we thought that having had some time to process the suspected diagnosis, because we were waiting on a couple test results to come back. So we knew what the doctor was leaning towards, but we were still holding out some hope that it was going to be wrong, the suspicions would be wrong, and we just were in total shock when they officially came back and confirmed that he had MPS II. A day in the life of Aiden consists of rotating therapies. So he has speech therapy, he has physical therapy, occupational therapy, and behavioral therapy. We have some practitioners that come to the house through early intervention, and then we do outpatient as well, in a gymnasium type of setting for the PT and OT. He is used to that routine. We're back and forth a lot, but it helps him and it keeps him active, and it just keeps his joints loose, and we are constantly going to doctors. He had just this past week a rotation of a neurologist, cardiologist, and pulmonary doctor every 6 months to a year, depending on the specialty. They want to see him to make sure that he is okay and that his organs are functioning properly. And then if there's any problems that arise, we can hopefully try to correct them or catch them in time before they get progressively worse. We also get weekly infusions. He was going to CHOP every week, every Thursday, 5-hour infusions of Elaprase. He has a central line port in his chest, and he gets this Elaprase medication, which is the only FDA-approved medication to treat Hunter syndrome. Maybe physical limitations. He has trouble getting up and down stairs. He just recently started getting up and down on a couch. He is predominantly nonverbal. He can say a few words, but he tries so hard to communicate too. He'll use some signs, and he'll definitely take your hand and show you exactly what he wants and point. And for a nonverbal child, he definitely has a lot to say, and you definitely can understand him, but it's just hard because I know he is frustrated since he tries so hard to talk. It's just not there. The words are just not the way a typical 2-year-old would be speaking and saying things at this age.